For the purposes of this exam, you are responding to a 42-year-old male complaining of chest pain.
BSI, is my scene safe?
Your scene is safe.
Based on what I'm seeing, it's going to be a nature of illness. I'm seeing one patient. I'm going to call for additional assistance, and then I'm going to consider C-spine but not take it. All right, so now we're going to move into the primary assessment. First, I'm going to make my general impression of the patient. It appears that he may be having possible chest pain because he's showing the Levine sign. He's hunched over. I'm going to walk up to him and determine his level of consciousness. So hi, sir. How are you doing?
I'm
EMT.
I'm Ben.
Nice to meet you. So I'm going to give him an A on AVPU. He talked to me and followed me as I walked towards him. Then I'm going to move into the chief complaint. So Ben, what seems to be hurting you today?
My chest just really hurts and it's really tight.
Okay, so now I'm going to move on to his ABCs. So since he's speaking to me, I'm going to assume that his airway is patent. I'm going to assess his ventilations to see if they're adequate.
Respirations are labored.
Okay, he has labored respirations. And then I'm going to administer my oxygen therapy. I'm going to do 15 liters non-rebreather mask. Then I'll move on to my circulation. So I'm going to assess and look for any major bleeding and control it if need be. I'm going to check his pulse bilaterally.
His pulse is strong and regular.
Okay, so a pulse is strong and regular. After I assess his pulse, I'm going to move on to assessing his skin's color, condition, and temperature.
Skins are pale, cool, and diaphoretic.
Okay, so he's pale, cool, and diaphoretic skins. So I'm going to make this patient a priority transport since he is having chest pain. So now I'm going to move into the history taking. I'm going to do OPQRST. So sir, did this come on sudden or slow?
It was pretty sudden.
Sudden? Okay. What were you doing when this happened?
I was hiking, about halfway through my hike.
Okay.
Yeah.
What's the quality of the pain? Can you describe it to me in words?
It's just very, very tight.
Very tight? Okay. What region is it in?
It's like in my chest and it goes down my left shoulder and arm.
Okay. Does it radiate anywhere?
Yeah, just really
down your arm? Okay. Has this happened before?
About a year ago, I had angina.
Okay. Is there anything you do that relieves it?
Yes, I'm prescribed nitroglycerin and aspirin. When I take that, it helps.
Okay, awesome. What would you say the severity of the pain is on a scale of 1 to 10? 10 being the worst and 1 being the least.
It's a 5.
It's a 5?
Mm-hmm.
Okay. And then how long ago did this pain start before I got here?
I'd say about 30 minutes.
About 30 minutes? Awesome.
Okay.
And then this is where I would ask any clarifying questions if need be. Now I'll move on to ample of history taking. So, sir, do you have any allergies to medications?
No.
No? Are you currently on any medications?
Just the nitroglycerin and aspirin.
Okay. Do you have any past permanent medical history of this happening or anything?
Just the angina a year ago.
Okay, no chest surgery?
No, sir.
Okay. When was your last oral intake?
About an hour ago, I ate some oatmeal.
Some oatmeal? Okay. And then I already know the events leading up to this. You were out hiking, correct?
Yes.
Okay. And now I'll move on to the secondary assessment where I will assess the affected area. So I'm going to ask the patient, sir, could I lift up your shirt, please?
Yeah.
I'm going to be looking for any surgical marks, maybe if he has a pacemaker, I'll be looking for that. And then I'm going to palpate his chest to see if that changes the pain on either side.
No.
Okay, and then I'll take my stethoscope and I will listen to each lung sound. So I'd have him take a deep breath, exhale, the 4 quadrants. Okay, and then that'll be it for secondary assessment for this patient. Now I'll move into vital signs. I'm going to get a pulse of the patient. I'm going to time 15 seconds, then times that by 4. I will simultaneously get respirations of the patient without him knowing, 15 seconds, times that by 4. Then I will get a blood pressure of the patient. Next, I will state my field impression. I believe that this patient is having a cardiac issue. Then I'm going to state the treatments I'm going to administer. So the patient stated that he took nitroglycerin and aspirin. So I will ask him for those medications. I will ensure the 5 rights, so right patient, right drug, right route, right dose, and right time, and check the expiration date. I will administer 1 tablet of nitroglycerin sublingual, and then I will administer a max of 324 milligrams of aspirin, and I will have him chew them before he swallows. Next, I will move into the reassessment, and I will properly show how to reassess this patient. I will take his vital signs every 5 minutes. I will ask him if he's still having chest pain. If he is, I could administer another dose of nitroglycerin if his blood pressure were within the limits. After that, I'm going to hand him off to arriving EMS units. So I have a 42-year-old male. He was out hiking. He came back home, started complaining of chest pain radiating down his left shoulder. I arrived, took his blood, his vitals. They were within normal limits. I administered 1 tablet of nitroglycerin sublingual and then 324 milligrams of baby aspirin.